So the concept of innovation means a lot of things to a lot of people. And you've heard today that we need innovative solutions to help solve this healthcare crisis that we're in. But sometimes innovation is a simple thing. Sometimes innovation is common sense that we just seem to have forgotten about. So the innovation that I'm going to talk about today is the astounding fact that the mouth is actually part of the body. You laugh. But I guess it was probably back in 1951 when there was a conference between the American Dental Association and the American Medical Association in which they did an analysis of focal infection theory. Now, as I look around the room, there are a few people that may have been around then. And the focal infection theory basically stated that an infection in one part of the body could have an impact on other systemic diseases in the body. Well, in 1951, we weren't as sophisticated as we are now. And the determining factor was, if you extracted teeth in 1951, did a patient get better? Did their diabetes get better? Did their heart condition get better? And the answer was no. And so from that moment on, 1951, every physician and every dentist was trained that the mouth had nothing to do with any other systemic condition in the body. Now, it wasn't until the 1990s that we actually developed some sophistication and we started doing research on a bacterial level, and we came to realize that an infection is an infection is an infection. Just because it's in the mouth doesn't make it any less impactful on the patient's health. So now we start to see research and studies that demonstrate a strong association between gum disease, which is the most common chronic infection amongst adults, and diabetes, heart conditions. And I won't go on from there because I think those are the two that are most important. You heard Dr. Hayes mention 44 cents out of every dollar goes to diabetes. Well, about 8 years ago, a first study was done that demonstrated that individuals who utilized their dental benefits and were diabetics had a 15% lower cost of managing their diabetes. 15% lower cost. There are strong associations between the infection that occurs in your mouth, how your body responds to that infection, and how you manage your overall health. If you're not paying attention to the fact that your gums bleed, you are very likely to also have other risk factors for diabetes. In a recent study in New York University, individuals with gum disease showed 90% risk factors for diabetes. Now, how many of you have actually seen your dentist this year? And how many have seen your physician this year? Okay? So actually very few numbers see the physician. With this group, I would expect that. But most individuals see their dentist much more often than they see their physician. We have an opportunity for an early screening. Dentists can actually do hemoglobin A1C testing. We have the ability to pre-screen patients. It's estimated that about 57 million Americans are pre-diabetic. That is, we're just on the cusp. And as we've heard, prevention is our greatest key. If we can identify individuals early and we can help to reduce this burden of cost and poor health on our society. Now, I'm a recovering jock, so I'll use an analogy from the basketball court. You can't drag a team to glory. It's going to take a team effort. And the part that I'm representing is that oral health is a part of that team, and that we have a contribution. We're not the answer, but we have a contribution. And it's very important that you all recognize that, as the Surgeon General's report stated, you cannot have good health without good oral health.